It's estimated that there's more than 700,000 meniscus surgeries performed in the US per year, most of them done on something called degenerative meniscus tears. These are insanely common. Now, unfortunately, the studies are pretty clearly saying that these degenerative meniscus tears are no better than a placebo surgery. But if you have the actual surgery on a degenerative meniscus, you have the added benefit of an increased risk of developing arthritis and an increased risk of eventually needing a joint replacement. If that's the case, you might ask, why are these surgeries still being performed? And that's a great question. So let's talk about it. So if you're unfamiliar with the term, a meniscus is a bit of cartilage in the knee that separates the thigh bone from the shin bone. You have two of these on each knee, one on the inside and one on the outside. The inside one is called the medial meniscus, the outside one is called the lateral meniscus. And these menisci can tear from an acute trauma, or they can just sort of degenerate over time. This video is pertaining to the more common one, the degenerative type, and if you or a loved one have been told that you need a degenerative meniscus surgery, or they're going to go in and clean up the meniscus or something like that, this video is for you. So let's quickly talk about the initial diagnosis. The initial diagnosis is usually done by MRI. However, studies show that meniscus lesions are equally prevalent in patients with pain or without pain, and therefore offer a poor explanation of knee pain. Now, despite that common finding that these tears are really common in people without pain, the presence of a tear on an MRI is often used as the rationale to go ahead and perform surgery on someone's painful knee. This is clearly flawed thinking, since the prevalence of these degenerative tears are just as common in people without pain as they are in people with pain. I mean, you could make the same analogy as like wrinkles on your face, right? As you get older, you start to get wrinkles on your face. We don't call it face degeneration, but for some reason, as we age, we see these more degenerative tears in the meniscus, and we call it degeneration, and it requires surgery. But they're just wrinkles in the knee. So let's move past the diagnosis and just talk about if someone decides to go ahead and get surgery on the knee for that. Well, we have multiple studies where they compare actual meniscus surgery to a placebo surgery. In other words, the patient is put under anesthesia. In half the group, they actually get the surgery, but in the other half of the group, they just put two little holes in there to make the person believe that they had surgery, but they didn't actually have the surgery. And the results show that there's really no difference between the placebo group and the actual surgery group. So let me repeat that. If you have a fake surgery or a sham surgery, there's no difference between the outcomes of that versus whether or not you got actual surgery. We have so much data on that. We have studies being published now with titles like this. Researchers are clearly upset that the surgeries are still being performed. There are also titles like this. In other words, why are we bothering with MRIs when these are so prevalent in people with and without pain? Even if the degenerative tear is there, we shouldn't perform surgery on it anyway. Unfortunately, the story doesn't end there though. Once you get the surgery, you're much more likely to get arthritis later in life compared to the group that didn't get the same surgery on the same type of meniscus tear. Now, you're also more likely to need a joint replacement later in life. And you may ask, why is that? Well, the meniscus provides a cushion that separates the femur or the thigh bone from the tibia, which is the shin bone. And that cushions the two bones, right? So once you remove some of that meniscus, you alter the contact points between the two bones, and it results in more likelihood of arthritis later in life. So the relationship is dose dependent. So in other words, the more of the meniscus you take out during surgery, the more likely you are to develop arthritis later in life. So if you want the least chance of developing arthritis later in life, it would follow that you want to take the least amount of the meniscus out. In other words, if you want the least chance of arthritis, don't take any of the meniscus out. So in summary, these surgeries were and still are being done on a massive scale in this country without much thought about the long-term implications of that. And the whole thing really makes me wonder about medical procedures or injections that are being done on a massive scale without any long-term, data to go on before those procedures are done, without any long-term follow-up. There's many examples of this in our past, and I'm sure there will be many examples of this to follow. So if you're suffering from knee pain and you want some help with it, we'd be happy to give you a hand. We'd be happy to provide a conservative management program and rehab program to help you get over your knee pain and to help you get back to the things that you love to do. Thanks. Bye.